The evidence for remote monitoring is rather variable. So if you look at any of the general society statements, whether it's the Heart Failure Society of America in 2018 or the ESC in 2016, they say different technologies seem to have different value. There's no consistent theme to it. It's difficult to identify which patient at which time point. So it is difficult, and you shouldn't think of remote monitoring as just one technology. It's a whole range of different technologies that can be used in very different ways. I think the signal is there that you need to look at the data very frequently. You need to act on the data promptly when you understand it marks deterioration. So the loop has to be quite short. Anything that slows that down destroys the value of remote monitoring. So it's a complex field, it's in evolution. I think we're all interested in seeing more data, more studies from different healthcare systems. But I think the policy direction is definitely moving towards wearables, remote technology, video consultation. Let's get you as a citizen able to access the best level care from wherever you are. So one of the problems, and the World Health Organization has highlighted this, is that remote monitoring and all sorts of digital technologies are implemented piecemeal. Some places do it, other places don't. The projects tend to be short-term. They tend to stop quite quickly. There's not really an overwhelming momentum in this area. I think some aspects of digital, like electronic medical records and electronic prescribing, already everybody does that. But for remote monitoring per se, it's very difficult to find a consistent pattern. So what we need to do is to have a stronger evidence base, a more intelligent discussion with all of the key stakeholders, stronger guideline support for it, and then also ways to help people to implement it. You just don't take a technology, plug it into your system, and expect it to have miraculous effect. It's about how it fits into the decision making, the timeliness of decision making, and also the reimbursement streams for that. So it can be complex, but I think we can see a way forward. But we need all the stakeholders to be in discussion: citizens, politicians, healthcare professions, regulators, reimbursement. And that's why the ESC Digital Committee has been set up, to show that cardiologists are very interested in getting involved in this.